Hello, I'm Dr. Woodworth from the Oxford University. Today we're going to be talking about the body, specifically the skeleton and some movement. So first let's talk about some everyday movement. So all movement lies on axes and planes. Each axis is perpendicular to its respective plane. So let's talk about the planes. So we have the frontal plane, which is vertical and extends from one part of the body to the other. Then there's transverse plane, which divides the body into the upper and lower half. And then there's the sagittal plane, which goes to the front of the body, like that. Now for the axis, we have the horizontal axis, which goes through the sides of the body, the anteroposterior axis, which goes through the body, and the longitudinal axis, which goes from the head to the feet. So let's talk about some movement. So the first movement is the flexion. It is this action, and then its opposite is an extension, which goes out, and it increases the angle. These movements lie on the horizontal axis and happen in the sagittal plane. Next is abduction. An abduction is where you move a body segment up, like this. The opposite is adduction, where you come down. These movements are on the anteroposterior axis and are on the frontal plane. The next movement is a supination. This movement happens in the wrist and is when you twist your hand, like that. The opposite is a pronation, where you twist your hand like this, like you're dribbling a basketball. This movement is on the anteroposterior axis on the frontal plane. After that, we have the plantar flexion. Plantar flexion is when you point your foot downwards, like that. The opposite is a dorsiflexion, when you're on the heel, like that. These movements are on the horizontal axis and the sagittal plane. Next is inversion, which happens in the ankle joint. And inversion happens when you twist your foot like that. The opposite is an eversion, when you twist it outwards. These movements are on the anteroposterior axis and the frontal plane. Then we have external rotations. This is when you twist or turn a body part outwards, externally, like this. Then there's internal rotations, which are rotations when a body part is twisted inwards to the midline, like this. These movements are on the longitudinal axis and the transverse plane. Next is elevation. An elevation is when a body part is moved up or in a superior direction, like raising your shoulders. The opposite is a depression, when the body part is moved down, like lowering your shoulders. These movements are on the anteroposterior axis and the frontal plane. Then we have a protraction, which is when a movement in a forward direction, such as sticking your chin out. Then there's the retraction, which is the opposite of moving a body part back, like moving your shoulders back, like that. These movements are on the horizontal axis and the sagittal plane. Lastly, we have a circumdiction. It is when you twist a body part of the joint, such as this, or moving your arm in a windmill position. These movements are on the longitudinal axis and the transverse plane. Now let's talk about the skeleton. So the skeleton is the main structure of the body that holds it together. It consists of two parts: the axial skeleton, which consists of the cranium, rib cage, and spine, and then the appendicular skeleton, which is the arms and the legs. So starting from the top, or most superior point, we have the cranium. The cranium consists of the frontal bone, the temporal bone, the zygomatic bone, the maxilla, which is above the mouth, and the mandible, also known as the jaw. Going lower down, we have the rib cage, which consists of the manubrium, the sternum, the xiphoid process, costal cartilage, and the 12 sets of ribs themselves. So in the ribs, we have 7 sets of true ribs, which are connected directly to the sternum by costal cartilage. Going lower down, we have 3 false ribs, which are connected via cartilage to the 7th pair of ribs. And then going lower down, we have the floating ribs. Now, our model is a bit distorted, but there you go. Now, going lower, now let's look at the arms. So starting at the shoulder, we have the clavicle. Then the more proximal long bone is the humerus. Proximal means closer. Then we have the fibula and the ulna being the more medial long bone, and the radius being the more lateral. Then onto the hands, We have the carpals, which make up the palms, the metacarpals, and the phalanges, which are the fingers. Going lower down, we have the pelvic region, we have the sacrum, and the symphysis pubis, which is there. Lastly, we have the legs, so connected to the pelvis, we have the femur, which is more proximal long bone. And then we have the patella, which is the knee joint bone. And then we have the fibula and tibia. The tibia is the more medial bone here, and the fibula is the more lateral. Lastly, we have the foot. We have the tarsals, the metatarsals, and the phalanges. Now that we have looked at the anterior side of the skeleton, let's look at the posterior side. So starting at the very top, the most superior end, we have the sagittarius. Then we have the parietal bone and the occipital bone. Then under the spine, which is divided into 3 regions. We have the cervical region, which has 7 vertebrae in it. These vertebrae are these little things on the spine. Then we have the thoracic region, which consists of 12 vertebrae. Then we have the lumbar region, which consists of 5 vertebrae. This is the most load-bearing part of the spine. Then onto the arms, we get a better view. We can see the previously mentioned bones like humerus, but we also see the scapula. Then onto the pelvic region, we can see the sacrum, the coccyx on the lower part, and we have the ilium here. Now we also get a better view of the foot, and on the back side we can see the calcaneus. Thank you for attending my educational presentation on the body, and I hope you learned something.